Here we'll talk about Asterixis. It's a negative type of myoclonus. In the previous video, we have talked about myoclonus. So it's a brief shock-like involuntary muscle contraction. It can be positive and the negative. So the example of negative myoclonus is Asterixis. It occurs when there is brief loss of muscle contraction, this negative myoclonus, right? So what is happening here? There is brief arithmetic interruptions of sustained muscle contraction, of sustained voluntary muscle contraction. So first we'll ask the patient to extend his arms and dorsiflex the wrist. And then we'll extend the dorsiflexed wrist further. So on extending the wrist further, patient will develop flapping tremors. This is a clinical sign called as Asterixis. If you look at the picture, you can see first the patient is asked to extend his arm, then the dorsiflexed wrist, right? So if we extend this dorsiflexed wrist further, there will be development of flapping tremors. Even you can check this for lower limb also. So now let us see the causes. So this Asterixis can be unilateral or the bilateral. So bilateral Asterixis can be seen in liver failure, renal failure, azotemia, respiratory failure, or use of certain drugs like benzodiazepines, barbiturates, phenytoin, valproic acid, lithium, carbamazepine, metoclopramide, yellow phosphorus, hypomagnesemia, or the hypokalemia. So in all these cases, you can see bilateral Asterixis. Liver. So now coming to the unilateral Asterixis. So it is seen in three conditions. One is the focal brain lesions at the different sites like pons, medulla, thalamus, primary motor cortex, cerebellum. The second is abnormal function of diencephalic motor centers, which will be regulating tones, right? And the third one, interruption of postural pathway, as in case of hepatic encephalopathy, CNS infection, organ failure, drug intoxication. So in the causes of bilateral Asterixis, just write the organ failures like liver failure, azotemia, respiratory failure, and write all the drugs like yellow phosphorus, benzodiazepines, barbiturates, phenytoins, valproic acid, lithium, carbamazepine, metoclopramide, all this, right? So it's a negative myoclonus, brief arithmetic interruptions of sustained voluntary muscle contraction. So first we'll ask the patient to extend his arm, dorsiflex the wrist, then we'll further extend the wrist, then you can see this flapping tremors, right? So negative myoclonus. So just write the causes. In the bilateral, just write this organ failures and drugs. And in the unilateral, write three things. One is brain lesions at different sites like thalamus, pons, medulla, and also diencephalic motor centers are not functioning properly, which will lead to impaired tone. And the third thing, interruption of postural pathway in certain cases of encephalopathy, CNS infection, organ failure, drug intoxication, and all. So you just have to treat the cause. That's it. Bye.